Hey guys, welcome back to another video. In today's video, let us talk about family planning, and we are going to start with vasectomy. I'm going to start with permanent family planning. Most people want permanent family planning, but they don't know the consequences. They just don't know all about it. They think that if they do permanent family planning, they might get babies if they want in future. They think that it is just for a short period of time. Maybe after 10 years they can decide and get babies, or they can decide to get pregnant again, or they can decide to impregnate somebody again. But let me tell you that if you want to go for any permanent family planning, make sure that you have already have the kids, that the number of the kids that you wanted. And my lecturer used to tell us that, used to ask us this question. In short, she did not like it. She used to say that, what if maybe you were traveling and you got accident, and maybe all if you were traveling, God forbid, and only the children got accident and they died on spot, and you are in a state where you can still give birth, and remember you have already cut the fallopian tubes, and you've already cut you did vasectomy. Sometimes it is risky because, you know, if you cut those things, that is the end of you with the kids. So if you want to do vasectomy or BTL, bilateral tube ligation, make sure that you are already you are aware of the consequences. You know that this method, it is a method that you are doing, and you will never ever want kid in your life, whichever the case. You don't want any kid again. Most of the time, the white people are the people who usually go for this, because some of them, white people usually give birth for what? They usually give birth few. They usually have few children, not even few. They usually give birth to one child, and that is all. That is what they want, and most of them, you will get that after that the woman will go for BTL, the husband will go for vasectomy, and even if whatever comes, even if which reason comes, they won't regret about it. So I think, let me talk about vasectomy today. Tomorrow or in the next video, I will talk about what? BTL, that is bilateral tubal ligation. Vasectomy is for men. So men, if you want family planning that is permanent, this is the right channel for you. Make sure you subscribe, like, share, comment. Don't forget to turn your notification bell, because you will be the first person to be notified about all these videos that I'm going to post. So let me talk about vasectomy, because I know most of you are wondering if it is the right thing to do vasectomy. Okay, vasectomy is a surgery that is safe and effective from effective form of permanent birth control. After vasectomy, you must have follow-up semen test to make sure there is no semen, there is no sperms in the semen. So what does that point mean? The point is saying that even after vasectomy, you might be having sperms in the semen. So which means that if you are having sex, you can see you will be still able to ejaculate, but ejaculation will only contain semen. It won't have sperms, because the tube that is connected to where sperms are being manufactured has been cut. That is what the point is saying in short. So I want to say that vasectomy is safe and effective for preventing pregnancy, and it is a permanent method, but it doesn't protect you against diseases. It won't protect you against HIV. It won't protect you against STIs. So you have to be careful if you are doing these things. If you are having sex, let me not say these things. If you are having sex, you must be careful, because it won't protect you from getting HIV and STIs. So you have to be more careful about it. Yeah. So another thing that I want to say, the only way to avoid getting pregnant is to avoid sexual intercourse. However, the failure rate of vasectomy is very low. In rare cases, you might get 1 out of 10,000. But it is possible after vasectomy, some sperms may still remain in the semen, and somebody might get pregnant few days after vasectomy. So vasectomy has been safe and successful in birth control method of many years. So just know that that is what it is. What will happen before a vasectomy? Before you have a vasectomy, certain things should happen. You must be aware of all these certain things that might happen or that will happen before you have vasectomy. So before you have vasectomy, you should talk with your healthcare provider seriously about the surgery. You should be sure that you don't want to have any child or more children. You should consider vasectomy as a permanent family planning or birth control, although there are some procedures to reverse it, vasectomy. It is not always successful sometimes, because you know, after you've cut those things, you cut the tubes, repairing them sometimes won't be easy. So your healthcare provider will also talk to you about history of excessive bleeding or blood disorder. If you have such condition, you might not go for the procedure. Allergy and sensitive to maybe some antibiotics and some anesthetic drug. Skin diseases involved in scrotum, especially infected pimples. Regular use of aspirin and medicine that contain aspirin or drug that affect bleeding. History of injury. Those are the things that maybe your healthcare provider will talk to you about, and your healthcare provider will make sure that you understand about it. That is the most important thing. You will have to consent, to give them permission to do that. You must give them the permission to do vasectomy, so that in case of anything, you are very responsible about it, so that you don't blame maybe the doctor who did it, you don't blame the healthcare provider, you don't blame the people who were involved in the procedure. So after the procedure is done, you might have some the wound. You must have a wound that will take few days to heal. You might have some pain. You might have allergic reaction to some of the drugs that were used, but just know that those will just disappear after a few days. Yeah, those are things that will appear after a few days. You ensure that you maintain hygiene. But the most important thing about vasectomy, just know it is a permanent, and it involves cutting off okay, it is a permanent procedure, or it is a permanent family planning, and the procedure closes off the end of the difference, which are the tube. It is a tube that carries sperms, and vasectomy, I said it is safe. So that is the only thing that I can insist about it. It is permanent. So before you decide to have it, it won't. You must make sure that you have gone through a very serious counseling. Maybe you are wondering if the sexual activities will stop. No, the sexual activities will go after you've healed. You can still engage in sex activities without any problem. You will still have the pleasure, you will still have the feelings, but you will not ejaculate sperms because the tube has been cut. So you can't impregnate a woman. I think I've reached the end of this video, and if you've not subscribed, that is the only thing that I can remind you to do. And let's meet in the next video, in the next episode of family planning.